To begin, first of all, I'm Robert Dempsey, and this is the Neurosurgery Department's update on the COVID crisis. I'm going to cover information, though, that it goes beyond our department, beyond our clinical department, but also is important worldwide, because this is a worldwide problem. And the issue is that we're dealing with something that's really unprecedented, and we've been dealing with it successfully by isolation. We're coming to a time when people are getting tired and beginning to want to break out of that isolation, which is quite natural, but needs to be done very carefully. The situation worldwide regarding COVID is that we're aware of about 3.6 million cases in the world. And of course, that's an undercount. We know that's affected most every part of the world, most every country. There are about 250,000 deaths that we're aware of, and that 1/3 of these are in the United States. Now, to me, that suggests that we probably are better at reporting or isolating, whereas in other countries, people that have unexplained deaths may not be clearly marked as this disease. This is something the epidemiologist. Within Wisconsin, it's quite a bit less. There are probably only 6,000 cases with 353 deaths. The Dane County is very, very good. And I believe that this is not because people here are genetically different, but rather that they were careful about isolating. We've had no new cases for the last 2 days in Dane County, and that's remarkable when you think that the rest of the world measures them in dozens of thousands of new cases. Because of this, we've been able to demonstrate that University Hospital can safely care for people with very strict provisions. And because of that, we are one of the places that is trying to open up. The reasons are quite clear. It's become abundantly clear that large numbers of patients have not been taking care of themselves, have not been going to their doctors, have not been having their chest pain evaluated, or their headaches, or their neurologic deficits, and they're coming late with strokes, late with cancers, late with heart attacks. We cannot have that. As a health system, we need to be available for them. So there's been a great deal of pushing in really the last 10 days to try to open up our services to people who need them in a safe way, and hope that that could be a model for other services and industries really throughout our economy. That's important because the economic deficit from the isolation has really caused about 35% of our nation to be out of work. And that's extremely devastating. It's also important that many of these industries that we hope to open up, your favorite restaurant, etc., really have such a small margin that if they open up and can only use 1/3 of their seating, they probably won't survive. However, many factories, etc., companies, I think laboratories, can be done safely with appropriate masking precautions, even though we're in the middle of this. It's important not to mistake that. People have come to believe that because people are talking about opening up, that this pandemic is over. It is not. As a matter of fact, the numbers are very consistent throughout the last couple of weeks, which suggests that there is no improvement with warmer weather. There is no improvement with different humidity. This knows no latitude barriers. And those of us that are very happy that we have been successful in avoiding, and I'll explain some of the numbers when we talk about antibodies, but our testing has shown very, very low levels in this county. And that's great, but that also means we're not immune to this. And if another hotspot bounces up somewhere, we could become a hotspot as well if we're not careful. So there are some very important steps that are taking place. We pushed very hard. If we want people to be trustworthy, trusting of their health system, many of them need to be able to bring a family member, either to the hospital for their surgery or to their clinic visits. Fortunately, this was finally approved this week, and I think it's a big game changer because all those visitors will be screened. We have enough PPE to be able to protect them and us as we do this, and I think it changes the approach that people have to their health care. I think it's an ideal model. for what could be done throughout our society, but much more carefully than just opening things up. You can see that even small groups of people have been able to cause superinfections. And so therefore, I don't think that bodes very well for putting 80,000 people in a football stadium anytime in the near future. A lot of inventive things which will try to get entertainment going again are being thought through. Along with our visitor policy, we're opening up the ORs and expanding them more and more toward a regular schedule. Today, we're up to about 73% of our regular schedule of surgeries. This is throughout the medical center. Neurosurgery, because of the acuity of the cases we do, has been somewhat in the forefront in that regard. But as we begin to open up in this coming week, our other centers of surgery, such as TAC, such as Meriter, such as the Surgery Center, and expand the services at each of them, we hope to provide more care for these important essential services that are provided through the total health care. There are some other things that are important. As we open clinics, we hope to open sites of services. And if this follows throughout the general medical profession, where people would feel safe to go to see their physician, I believe the level of care will be greatly improved. There are a couple of updates that I think are important, which would help us understand where we are. Research is very important to us. It's very important for COVID-19. Research, which was done very well, suggested that an antiviral, which was used originally for Ebola and not successfully, is successful in mitigating some of the symptoms of this particular disease. That suggests that people that have it may be more likely to survive. A great deal of emphasis has been recently placed on antibody testing. It has both good and bad. As far as just testing antibodies, there's important implications to that. First of all, they're imperfect. They have a definite false positive and false negative, and some are not as good as others. But even the best antibodies, if we understand in the middle of a pandemic who has antibodies and who doesn't, how do we use that information? If we use it to segregate people, only harm will come of that. However, it is important for some things. There are some particular conditions which we believe are related to this virus. Because the virus, when we talked about the receptors that this virus can attach to, and its particular potential to attach to respiratory epithelial cells, that isn't the only cell it can attach to. Its receptors are found in blood vessels, in brain, and kidneys. And we're beginning to believe that there are certain people that are presenting with abnormal renal failure or abnormal vasculopathies, including the COVID toes of children, which may be subclinical, not respiratory infections, which the antibody response, which is very active in children, has caused this vasculopathy, which we see in the blue toes of these children. They do well because their immune system has been hypercharged to stop the virus. But in adults with this hypercharged immune system, they may develop renal failure. Antibody testing of them may show us that they had the infection, it just wasn't in their respiratory epithelium, and that's why their actual classic testing for COVID was not positive. So that's one very important reason to see if the immune system is active. The other is to check for staff and patients. Now, we have checked our staff, and the rate of positives in our staff is less than 1%. In other words, either less than 1% of the staff here at the hospital have been exposed to COVID-19, or remember, that's less than the error for the test. So all I can say is that it's very, very unlikely that your physician or your nurse has been infected with this disease, and therefore this is a safe place. But it also gives us caution as we open up society that we are not immune to this, and we are quite susceptible. Even if we had the antibodies, we don't know how long that immunity will last. So we still work to contain it, to work for a vaccine and to try to supercharge that search for a vaccine. So what I'm saying is we're looking at being in this for the long haul and remaining careful. We've been very good at this here at the hospital. I'm confident about our care here. I'm much more concerned about society. In that rush to reopen society, we could do harm, and that therefore must be done carefully, gradually, and this is the type of testing that we talked about. If you think about the other things, I'll be meeting with the dean, and just as I pushed hard to get visitors to be allowed to go and accompany their family member for healthcare visits, I'll be pushing for the research labs and the students. I think that's very important for medical students to be involved in a disease like this and not to be on the sidelines, to understand what it is, to understand how to protect, and if we have adequate PPE, that they be included. Obviously, if we don't, they'll take different duties than it being on the front line. I think research is essential, just as I said that our basic medical care of brain tumors, of strokes, of pain, of congenital anomalies in children must continue and must not be limited. We must not stop our research, because even though that research may be in something completely different than COVID-19, it's all related. Whether it be tumors or strokes or pain, it's all related. Therefore, I'll be pushing to try to get the labs open so that we can safely, with safe distancing, with safe protections, with masks, etc., continue. I believe some of our research labs we can physically isolate and still do that research. In others, we cannot. And just like the industries and research, certain things will lend themselves to more of a resumption than others. But in no case will it be normal. And I think that's true about our society. We've shown that we can do this. We've done a wonderful job of protecting each other by the way we have been careful about everything from hand washing to social isolation. As we see things changing, as we see the possibility that the state Supreme Court may force the opening of the state, we have to do it carefully. And I think that's probably the most important message, that there is a lot of hope right now, but we must be cautious. I'm very proud of what the department has done so far, and I'm very happy to say that we are well prepared. As we begin to open the hospital and the department up a little bit more slowly, and we cannot really open up the labs or the offices until we get approval at the dean's level, but I hope that will come and come soon. I know we're already planning to bring the students back in the next months. I hope we can move that forward, but we need to continue to be sensible about this and protect each other. That's the most important message, and it's one of hope at a time of great difficulty, but great possibility for us to do good. It's what we do it well. I'm very proud of us. Thank you very much. I'd be happy to answer any questions if people know if there are chats, because I don't have access to that chat. Or if they want to unmute themselves and ask questions. This would be a good time. When can residents see new patients in clinic in person? It's a great question. I'm not against it at all right now, as long as we have the protective equipment. I'm not certain of any rules against that at this time. I have allowed the residents to resume their previous call schedules of activities.
I believe it's okay,
Yeah.
Dr. Dempsey.
I think that is okay. I would like it to be extended to residents if we can do it safely, and students. Other questions? And you can unmute as well.
I don't see any other chat
Okay.
questions.
You usually have one for me. But I think we've covered the important things. We are opening up to patients. I hope to, and residents, I hope to open up to students and researchers. And I hope that the rules that we have put in place to be safe in a hospital can be transferred to our society, which will be different, but will be at least safe as people begin to become more normal. Thank you very much.
All right, don't forget to thank a nurse, everybody.
Yes, this is the start of Nurses Week. We are doing things for them. Be sure to informally thank them as well. Thanks very much for all you do.
Take care. Thanks.
Thank you.